If you give someone a mismatching blood type, you may cause the patient's blood to agglutinate or clump together and start to undergo hemolysis, or the red blood cells start to break apart. This becomes a life-threatening medical emergency for your patient. The patient may experience fever, chills, nausea, vomiting, tachycardia, and hypotension and shock. This often happens within the first hour of the blood transfusion. Why does this happen? We have antibodies that move throughout the fluids in our body, detecting whether cells are the same as ours or foreign. When they encounter something foreign, they attach to it and help eliminate it. In fact, this is for our own good. So let's look back at our type A blood type patient. Remember that they have A-type antigens on their red blood cell surfaces. If you give them type A blood as a donor, great news. The donor blood also has A antigens on its surface, and the patient receiving the blood will recognize it as self and not as foreign. Therefore, the patient's antibodies will not react, and agglutination will not occur. If, however, you give a type A blood patient type B blood, they will have a reaction. The person receiving the donation has A type antigens on the surface of their red blood cells, while the donor blood has B type antigens on its surface. The recipient's body will recognize these B antigens as foreign and mount an immune response, leading to an agglutination reaction. If a type A patient receives a blood donation from a type AB donor, it will not work and will cause a transfusion reaction. The type A patient has type A antigens on their red blood cells and anti-B antibodies in their plasma. The donor's type AB blood has both A and B antigens on its red blood cells. While the A antigens are compatible, the B antigens on the donor cells will be recognized as foreign by the patient's anti-B antibodies. This triggers agglutination, a clumping of the cells, and hemolysis or destruction of the donor red blood cells. Lastly, what about a type A blood patient receiving a donation from a type O blood donor? Remember that type O blood only has the base H antigen on the surface of its red blood cells, which does not trigger a foreign reaction because it is the foundation for all red blood cell antigens. Since there are no A or B antigens present for the recipient's antibodies to recognize as foreign, type O blood will not cause an immune reaction and can be safely donated to a patient with type A blood. What about the Rh factor? Let's say our patient is Rh negative. Let's look at the rules. If a patient is Rh negative, they should only receive Rh negative blood. Remember, being Rh negative means they lack the extra protein or the Rh antigen on their red blood cells. Being Rh positive means that this protein is present. If a patient who is Rh negative receives a blood donation with Rh positive blood, their immune system can recognize the Rh antigen as foreign and may develop antibodies against it. This can lead to a transfusion reaction, where the body attacks the transfused red blood cells, causing agglutination and destruction of those cells. If the patient is Rh positive, they can receive both Rh positive and Rh negative blood. The Rh positive blood will match the protein already present on the patient's red blood cells, so there is no immune reaction. Rh negative blood lacks this antigen, so there is nothing foreign for the patient's immune system to recognize, and therefore no reaction will occur. This is why Rh positive patients can safely receive either Rh positive or Rh negative blood.